Robert F. Kennedy Jr., the new Secretary of the Department of Health and Human Services, is now looking to focus the program on healthier options. Cameron Limes explains what that can mean.
It's too vague, it doesn't, too much room for gray area, and it's going to become a problem.
We cannot mess with these programs with knee-jerk reactions.
RFK Jr. has proposed changing the items eligible to be purchased with food stamps, saying they should go in a healthier direction and limit the amount of highly processed food and, quote, junk food people could buy.
And like you say, these fresh produce stuff, they cost more money. So if I'm only getting $100, $200 on food stamps, a carton of egg is $10 now. I could spend $20 on a loaf of bread, a carton of egg, a loaf of bread, a gallon of milk, and a carton of eggs. I already spent $20.
RFK Jr. has recently put forth a proposal that has ignited widespread debate, banning the purchase of junk food using welfare food stamps or electronic benefits transfer, EBT. At first glance, this policy appears to be a well-intentioned measure aimed at improving the health outcomes of low-income populations. By restricting the use of government assistance to buy foods that are high in calories but low in nutritional value, the policy seeks to curb the rising rates of obesity, diabetes, and heart disease that disproportionately affect communities on welfare. The core idea behind this proposal is to nudge individuals toward making healthier food choices. Proponents argue that if welfare funds could only be used to purchase nutritious items, recipients might be encouraged to adopt better eating habits, which in turn could lead to reduced healthcare costs and an overall improvement in public health. However, while the vision behind RFK Jr.'s proposal has merit, it is important to critically analyze the practical implications and underlying assumptions of such a policy before it is implemented. The positive intent: addressing public health crises. The United States faces a significant public health challenge when it comes to diet-related illnesses. Chronic conditions like obesity, type 2 diabetes, and cardiovascular disease are on the rise, with low-income communities often bearing the brunt of these issues. Junk food, defined as items high in sugar, unhealthy fats, and sodium, has been linked to these conditions. By restricting welfare funds from being used to purchase these foods, RFK Jr.'s proposal aims to create a healthier food environment for individuals who rely on government assistance. From a purely health-focused perspective, this policy could lead to several positive outcomes. If welfare recipients are limited to buying healthier foods such as fruits, vegetables, whole grains, and lean proteins, it is plausible to expect a reduction in the prevalence of diet-related diseases. In the long run, this could decrease the overall healthcare burden on society. Reduced rates of chronic illness mean fewer hospital visits, lower medical costs, and a better quality of life for individuals who might otherwise be at risk for debilitating conditions. Furthermore, such a policy could serve as a catalyst for broader public health reforms. It might spark a nationwide conversation about nutritional standards and encourage further government initiatives aimed at reducing the consumption of unhealthy foods. In theory, by creating financial disincentives for buying junk food, RFK Jr.'s proposal could shift consumer behavior in a way that benefits public health. Criticisms and potential pitfalls. While the positive intentions of the proposal are clear, there are several significant criticisms and challenges that need to be addressed. One of the main criticisms is that this policy is inherently paternalistic. By dictating what low-income individuals can or cannot purchase with their government benefits, it implies that these citizens are incapable of making their own dietary decisions. This approach not only undermines personal autonomy but also risks stigmatizing welfare recipients. The message conveyed is that those receiving assistance are untrustworthy when it comes to managing their diets, which can foster feelings of shame and resentment. It is important to remember that many people on welfare face numerous systemic challenges, and restricting their food choices might further exacerbate their sense of disenfranchisement. Defining junk food. Another issue lies in the complexity of defining what exactly constitutes junk food. Food products exist on a spectrum, and many items contain both healthy and unhealthy components. For example, a granola bar might be high in sugar but also provide fiber and protein. Creating a rigid classification system that differentiates between acceptable and unacceptable products could lead to confusion and inconsistent enforcement. Additionally, manufacturers might alter recipes just enough to circumvent the regulations without making any meaningful improvements to the nutritional content of their products. This could result in a game of regulatory one-upmanship that ultimately fails to achieve the desired health outcomes. Perhaps the most significant criticism is that restricting junk food purchases with welfare funds does little to address the root cause of the problem: the affordability and accessibility of healthy foods. Many low-income communities are located in so-called food deserts, where fresh produce and nutritious options are scarce. Even if junk food is removed from the list of eligible purchases, recipients might find themselves with few alternatives that are both nutritious and affordable. Without concurrent efforts to make healthy food more accessible, such a ban may simply limit choices without improving nutritional outcomes. There is also the risk of unintended consequences. Welfare recipients might turn to purchasing food through other means, such as out-of-pocket cash, thereby circumventing the policy entirely. This could lead to a situation where the ban does little to change eating habits, while simultaneously creating additional administrative burdens for agencies overseeing food stamp programs. Before any restrictions on junk food purchases are implemented, it is imperative to address the underlying issue of food affordability. A policy that limits access to junk food is only as effective as the availability and affordability of its intended substitutes, namely healthy foods. One approach is to subsidize healthy foods such as fruits, vegetables, lean proteins, and whole grains. By lowering the cost of these items, government agencies and local communities can make nutritious options more accessible to low-income families. For example, programs that offer discounts on fresh produce in grocery stores or farmers markets have proven effective in encouraging healthier eating habits. These subsidies can be designed to work in tandem with the proposed junk food ban, ensuring that recipients have viable alternatives to choose from. Improving food access in underserved areas. Many low-income neighborhoods are plagued by food deserts, where access to supermarkets and healthy food options is limited. Investing in infrastructure to bring fresh produce to these areas is critical. This might involve supporting community gardens, mobile markets, or local cooperatives that prioritize the distribution of healthy foods. Efforts to improve transportation links and incentivize grocery stores to open in underserved areas can also make a significant difference. Alongside efforts to make healthy food more affordable, there should be robust nutrition education programs in place. Educating recipients about the benefits of a balanced diet and how to prepare nutritious meals can empower them to make better food choices. Workshops, cooking classes, and online resources can all play a role in fostering a culture of health. When people understand not only what to eat but why it matters, they are more likely to embrace healthier lifestyles. Community-based initiatives. Local governments and community organizations can also play a pivotal role. Initiatives such as community-supported agriculture, CSA, programs, local health fairs, and partnerships with nonprofit organizations can create a supportive environment for healthier eating. By engaging communities directly, these programs can ensure that the benefits of increased access to nutritious foods are felt at the grassroots level. A holistic approach to public health. The debate over RFK Jr.'s proposal ultimately boils down to a broader question. How do we best support the health and well-being of our citizens? While restricting the use of welfare funds for junk food purchases is one strategy, it is far from a complete solution. A holistic approach that simultaneously tackles affordability, accessibility, and education is essential for achieving lasting change. Imagine a scenario where, rather than simply banning junk food, a comprehensive program is launched that offers healthy food subsidies, builds local food infrastructure, and provides targeted nutrition education. In such a framework, the junk food ban could serve as one component of a multifaceted strategy that not only discourages unhealthy eating habits, but actively promotes a healthier lifestyle. This approach respects individual choice while creating an environment in which the healthier option is also the more accessible and affordable one. Critics of RFK Jr.'s proposal rightly point out that without addressing the systemic issues of food insecurity and affordability, the ban could end up being both ineffective and stigmatizing. However, if implemented as part of a broader reform package, the idea could play a valuable role in transforming the way we think about public health and welfare support. By ensuring that every citizen has access to nutritious food options, we can work toward a society where health is not a privilege but a right. Conclusion: balancing good intentions with practical realities. In conclusion, RFK Jr.'s proposal to ban junk food purchases with welfare food stamps or EBT is rooted in a desire to improve public health by reducing the consumption of nutritionally poor foods among low-income populations. While the idea is commendable in its ambition to address serious health concerns, it also raises significant issues regarding personal autonomy, definition and enforcement challenges, and, crucially, the availability of healthy alternatives. For this proposal to be truly effective, it must be part of a larger, integrated strategy that first makes healthy foods more affordable and accessible to all. By subsidizing nutritious foods, investing in local food infrastructure, and providing comprehensive nutrition education, we can create an environment where healthier choices are not only mandated, but are also the natural, easy option for everyone. Only by tackling these fundamental challenges can we hope to achieve a lasting improvement in public health outcomes. RFK Jr.'s idea, therefore, should be seen not as an isolated measure, but as one element in a broader, more holistic effort to transform our food system and support the well-being of all citizens. The journey toward a healthier society is complex, but with balanced, thoughtful policies, we can make strides that benefit everyone.